If you experience sharp pain on the side of your hip when lying in bed, you are not alone. But chances are, you've been focusing on the wrong diagnosis. Research reveals that most people who treat their hip pain as bursitis are missing the real underlying cause and making their pain worse with common habits. The myth of bursitis. For years, outer hip pain, medically known as greater trochanteric pain syndrome, has been almost automatically diagnosed as hip bursitis, inflammation of the bursa, a fluid-filled sac. However, modern research shows that bursitis only accounts for a small minority of cases, typically around 8%. The true culprit in the vast majority of cases is tendinopathy or tendinitis, inflammation and degradation of the muscle tendons that attach to the outer hip bone. Stop sign 4 habits to stop right now. If your pain is caused by inflamed tendons, certain everyday actions are straining those tendons and delaying your recovery. To truly heal, you must stop these 4 things. Stop stretching your glutes. Stretching inflamed tendons actually pulls on the irritated tissue, causing further strain and irritation. Stop crossing your legs. When sitting, crossing your legs puts unnecessary rotational stress and tension on the outer hip tendons. Stop standing on one leg. Standing with all your weight shifted to one side, often called hip hanging, overloads the painful tendons. Stop doing clam exercises. Exercises like the clam, done while lying down, can cause the tendons to rub excessively against the hip bone, worsening the irritation. White heavy check mark the real fix, targeted strengthening. The path to pain relief is not stretching or rest, but targeted strengthening of the outer gluteal muscles, specifically the gluteus medius and minimus, and their tendons. This process stabilizes the hip, relieves pressure on the tendons, and helps soothe any coexisting bursitis. Crucially, this strengthening should be done while standing, as this position best mimics the functional way your hip muscles support your body weight during walking and daily activities. Person lifting weights: the ultimate exercise, the standing pelvic tilt. This exercise uses your own body weight to strengthen the muscles correctly. How to perform it? Setup: stand facing a wall, placing your hands on it for balance. Balance on the leg of your painful hip. Bend your non-weight-bearing knee. Step 1. Leg out. Move your bent knee out to the side as far as it can comfortably go. Step 2. Slow pelvic tilt up. The key now, activate the muscles on the side of your standing hip. Use them to slowly tilt the opposite side of your pelvis up, lifting your bent knee even higher. Pause briefly at the top. Step 3. Slow lowering. Slowly lower your pelvis and leg back down. The key is to consciously separate the movements. Use your side hip muscles to perform that small, slow pelvic tilt in step 2. This isolates the correct muscles that need strengthening. Frequency and recovery. Reps: stop when you feel a burn or fatigue in your outer gluteal muscles, typically between 2 and 10 repetitions. Schedule: perform this exercise 3 times per week to light fatigue, ensuring you have at least 1 rest day between sessions. Hourglass not done recovery timeline: be patient. If the pain is primarily muscular, you may notice improvement within a couple of days to a couple of weeks. However, if you are suffering from true tendinopathy, the tendons take longer to remodel. You may feel initial improvements in 3 to 6 weeks, but it can take a few months for full resolution. The takeaway is persistence. Once your pain is gone, continue this exercise periodically to keep your hip muscles strong and prevent the pain from returning. Would you like me to provide a step-by-step guide on how to perform the standing pelvic tilt exercise in an easy-to-read list format?